Hello, my name is Ronald Peters. I'm a medical doctor at MindBody Medicine Center. I wanted to tell you a little bit about how effective MindBody medicine is for the medical problems of our day. I studied biology at Stanford University and then went on to UCLA to study medicine. At UCLA, I learned how to treat serious disease using high-tech medical tools, which was very useful. I also learned how to treat common illnesses like high blood pressure, heart disease, diabetes, and other chronic diseases, but it was mainly using pharmaceuticals. I entered into the practice of family medicine using what I had learned, and after a year or so I was a little frustrated. I was giving people an endless variety of symptomatic medications. I wasn't helping them to heal or reverse their medical problems, but they just needed to take medications on and on and on. So I went back to UCLA, this time to the School of Public Health, to study the epidemiology of chronic illness. Following my years at UCLA, I began what I consider to be my learning and healing. I started a long-term, ongoing study of nutritional medicine. The purpose of nutritional medicine is to understand the enormous complexity of the body, how all the systems interrelate and work together. The digestive system, the immune system, adrenal function, thyroid and other hormones, the detoxification system. It's like a wonderful biological orchestra, and in order to have good music, all of the different players need to play together. So I began using these tools to promote health in the body. When you promote health in the body, people begin to get better consistently. It's different from the medical model of treating disease using a symptomatic medication. It's very different. So the results were much better. People were feeling better, their energy was improving, their moods were improving, but still there was a missing piece. I then had the great good fortune of studying with two master teachers who helped me to understand the powerful governing influence of the mind. The mind is partly conscious and it is unconscious as well. This was the important part because the conscious and unconscious mind actually governs how the body works. This is missing in our current medical world. I began using these principles first on myself and then on my patients over many years, and now the results were much, much better. People began to understand how their stressful life experience helped to create an illness, and they could use that understanding to reverse the illness. Using the tools of nutritional medicine and laboratory testing, they could understand what was the best diet for them amongst all the different options. They could understand what the best nutrients were to promote health and the complexity of the body wisdom. And they felt empowered. They felt there was something they could do to make changes so that they could heed the message of illness. The purpose of disease is to get our attention so we can make changes to reverse the illness. In the medical model in our world, we tend to take a symptomatic medication which suppresses the message, and it's not listened to. The purpose of disease is to produce healing. MindBody medicine is the solution to the epidemic of chronic disease in our society. 60% of Americans have one or more chronic illness, such as high blood pressure, heart disease, diabetes, depression, arthritis, and others. Doctors manage these diseases. Using MindBody medicine, we can now begin to heal these diseases. It's a very powerful adventure. I look forward to working with you. We have an excellent staff. Thank you for listening.